We're here with Javier Amión de Guerra. He graduated from Tecnológico de Monterrey in 2015 from med school. Then he was in research in Houston, and now he's going to study internal medicine in San Antonio.
During this semester, we studied lung cancer.
So what normally causes the disease?
Lung cancer, as in any type of cancer, it's caused by the multiple processes that include genetic background. There's several risk factors. One of them is smoking. There's also exposure to several chemicals, for example, in the construction of old houses with asbestos exposure, some heavy metal exposure. As I said, it's multifactorial, and of course the risk increases with the amount of smoking a person has been doing in the past, and also the age of the person. It's a multifactorial process. It's most of the cancers that we know of.
How serious is the disease and how does it affect the patient's current lifestyle?
Lung cancer, it's caught up in an advanced stage. I would say depends on the stage that we get lung cancer. The person will more likely die. On average, I would say an advanced disease, the median survival, meaning that almost half of the patient will be dead by 5 years. So it's a deadly disease, and also when it goes to quality of life, I mean it's an invasive cancer with a lot of symptoms that affect the patient's quality of life. Plus, if the patient sought aggressive treatment or we start radiotherapy or chemotherapy, that also, of course, affects quality of life.
What is a patient's prognosis?
Lung cancer is the deadliest type of cancer that exists. That being said, prognosis varies across the stage of the cancer that's detected. Clinical grade of cancer, category 1 of cancer, has a really good prognosis when compared to the more advanced type, where if it's grade 4, 5-year survival in the newer classification can come close to 0. So none of the patients will be alive despite current treatments. So it's the prognosis. I would say it's a bad. The type of cancer that's probably the worst.
When a lung cancer patient comes, what is its chief complaint?
I would say there's 3 main symptoms. I would say cough will be the first one. The second one will be weight loss. So when any patient that comes with unexplained weight loss, you always expect something malignant like going on. Another common symptom called hemoptysis, which means there will be coughing blood. Now, that doesn't mean that every patient that coughs blood will have lung cancer. They will come with different symptoms. There's something which I call paraneoplastic syndromes. Paraneoplastic syndromes will be more common in the other type of lung cancer, small cell, which basically mean that the cancer cell produces something, a protein or a hormone, that causes an effect on other parts of the body. For example, it can produce, it can do metastasis to the bone, or it can also produce a protein that will increase the calcium in your blood. And patients may have those symptoms.
How are patients usually tested for the disease?
The very first I want to know is, of course, I want to do an imaging study. That will be a chest X-ray. That will be usually the first thing you will do. I would get a chest X-ray. If I see an X-ray and suspicious, then I'll get a high resolution CT scan of the chest, to see if that mass is suspicious. If I find something bad, then you would also want to do with the tomography, with the CT scan. Now, very important with lung cancer is once you get an image that's suspicious of lung cancer, plus the clinic, which is the physical exam and everything you see in the patient, lung cancer requires that you need to do some procedure to get a piece of that tumor so I can stage it. And then I need to know if your lymph nodes do also have cancer. And that will determine A, what treatment you are going to give the patient, and B is what is the prognosis for the patient.
What are the treatment options for our patients?
So it depends on the stage. So we can broadly divide them in 3 categories. I would say from stage 1 and 2, you want to resect, so you want to do surgery. So 1 and 2 means it's localized disease. And that could be curative. So usually for 1 and 2, when you want to get tissue, you want to be a little bit more invasive, so in the sense that you want to open the chest cavity maybe and try to resect as much as you can that tumor, take that piece off. And depending on the pathology, if it's an advanced grade, that's a little bit more advanced, you might add on some chemotherapy or radiotherapy. And then stage 4, that's a little more complicated. You offer the patient what we call palliative care, where maybe the patient or the patient family doesn't want to go on with treatment, and then you just basically ask them if they just want us to manage their symptom. But I would say if you can resect the tumor and take it all out, there's no involvement of the lymph nodes or in other parts of the body, I would say that's the most effective form of therapy.
If a person doesn't receive treatment, what would happen?
Obviously, the cancer will advance. If you detect the cancer early, there's more chance of surviving a longer period of time. It's kind of it's tough to estimate untreated survival. But I would say yes, probably in advanced stage, probably 7 months, 8 months.
What are the most important new technologies for preventing or diagnosing or treatment?
So new technologies have made that the people that make them better, that you get exposed to. It's called low dose CT scan. So there's much less radiation you're exposed to. So there's been studies that where you know that you can do it in smokers without really increasing the risk and actually increasing their survival by detecting the cancer early. Now we don't do it on everyone, and you don't do it on people that don't smoke, because there's no evidence that it increases survival. But I would say for prevention, that's where technology has helped a lot. Now treatment, that's I would say the most advances we've done, I would say in the last maybe 7 years. Laboratory techniques to identify certain mutations and then develop a new pharmacological therapy to attack those cells. These new drugs, which are called usually biologicals, what they do is they attack specifically that protein in that particular cell. And for example, if there's a particular what we call oncogene, which is a gene that increases the cancer in the cells, increases the cancer cells are immortal. If you decrease that, if you block that cell, then you can stop the cancer from spreading or even regress. Those technology, both in the laboratory and in pharmaceuticals, have helped lung cancer treatment a lot.
Thank you very much for your time and for answering our questions.